I have heard a lot of discussions of gender affirming clinics for youth closing around the country right now. And from a medical ethical perspective, when you are going to discontinue care for a patient, you have to provide an option for care from somewhere else. You can't, in the middle of care, just discontinue it and hope they find their way. You have a responsibility to help them complete care. Why? Because it's not really safe or in the best interest of the patient's health, no matter what you think of the care, to just stop treatment in the middle of a treatment. Think about any treatment in medicine, chemotherapy, diabetic treatment, anything at all. And just imagine in the middle of treatment, everything being taken away just before it was complete, before whatever the goal of that treatment was had been accomplished. We don't do that. Our job is to provide care somewhere else. So, what happened is many of these clinics, the decision to close was from the hospital board, not from the providers. And then the providers were given the message, you're closed now. And they had to scramble to try to find options for their patients. In the meantime, patients were having their appointments canceled, not understanding why sometimes. They were calling in for prescription refills and nothing was happening. They didn't know if the clinic's busy or what was going on. People were not responding. Why? Because lawyers had to get involved, make sure they answer appropriately. Because providers were trying to figure out what they could and couldn't do per their hospital board, how to help them continue their treatments, etc. So I wanted to break down today because many of you listening may be like, okay, you may not understand what does that mean for the individual patients. And I want to break it down based on ages and stages of their healthcare. And I want you to consider something else, that there are a group of patients that have been through a puberty before they got gender affirming care and then got gender affirming care and went through a second puberty in order for them to be in alignment with themselves. So they've been through two puberties. There are other patients that started a puberty but didn't complete it, got blocked, and then given hormones at the appropriate time to go through a puberty, and they've been through one complete puberty. So let's break it down by ages and stages. So those patients that are 19 and over, and yes, 19 and over may still have been going to a pediatric gender clinic. I say pediatric because it's in a children's hospital. They're 19 years old. It is not uncommon if they've been getting their care that they may not have transition care to the adult care, which often happens even in the pediatrician's office outside of gender affirming care, many times until kids get to about 21, 22, that they will move them along because maybe they're in college and they haven't established where they'll be yet, or lots of various factors. So for those 19 and over that might still be going, they can establish care at an adult clinic. You say, why not 18? Well, I'll get to that in just a second. 19 and over can establish care. However, if they are still under their parents' insurance, then you gotta hope they're in the same place. And depending on the insurance, are they covered anywhere in the state they live in, or are there only the institutions in the town they live in? I don't know. That's going to play a role. And if they're out of state, are they covered by insurance to get care? And everyone's going to be different. There's a different answer for everybody. Here's the thing. All of a sudden cutting off care for those individuals and they need to establish care in a new place. The wait times are like a month. Do they have at least a month's worth of medication left to get to there? Now, I can tell you for those that are taking testosterone, they can only get a month at a time because it's a controlled substance. So hopefully they just had it refilled before everything shut down. But if not, They're in a very difficult position to get their medication refilled when they're cut off, establish care someone else, when the wait times are long. And you're like, what's the big deal? Well, it is a big deal. Think of anyone you know that's on hormones just to like wipe it away and take off your hormones for a period of time without doing it in a medically controlled way. Just gone. Instead of trying to do it the gentlest, imitate the way a body would decrease hormones and not just cut them off cold turkey. So there's that. There's also the panic that without hormones, they may begin to go through another puberty. So for some, that'll be their third, that'll some will be their second, depending how long it takes them to establish new care. And many kids who are 19 aren't going to have puberty blockers, which sometimes act as a nice backup of at least not having the body begin to go through a puberty. Let's take a transgender boy at the age of 19. He no longer has any sort of puberty blocker. He's on testosterone. If you take the testosterone away, what happens? Any facial hair that's there will stay. That won't change. May redistribute the fat, like fat going to the hips. They also may start to have periods, which can cause dysphoria for many patients. And then think about those that got puberty blockers at the start of their puberty and so only went through one complete puberty. You take testosterone away, their body is going to have chest development. Not immediately. It doesn't happen overnight. It happens over time. Again, this depends on how long does it take to get new care. How long does it take to refill a medication? I personally think no matter what you think about gender affirming care, medically irresponsible to cut off care like that and not ensure that their medication is continued or the options are given to taper down. If the patient's 18, you might think, well, they can also go to an adult clinic. It depends because so many of the executive orders said under 19, which means 18 is under 19. And so some clinics are a little afraid to be on the federal government's bad side. And this puts the 18-year-olds in a very difficult position. They are adults. They can get care anywhere else in the adult healthcare facility. But the gender clinic, people that do gender affirming care for adults are afraid to touch them. So hopefully those adult clinics come to their senses, realizing that everyone else in their system will treat them. The pulmonologist will see them, the allergist will see them, everyone else will see them. So see them. Let's hope. Now we go to the next group of patients, the ones that are somewhere between 14 and 17, the ones that are on hormones. Many of them probably still have puberty blockers. Hormones cut out, so they have the puberty blockers, hopefully. Now, if they the injection, depends when the last time they had the injection and which injection did they have. There's a puberty blocker injection that lasts 1 month, 3 month, or 6 months. It gives them an idea how long they have. For them to establish care, they either need to find a gender affirming care clinic in a state that is still going, that hasn't discontinued care. There's not many of them left. Or they have to go to a private practice that does gender affirming care. They need to find one. Private practice that doesn't accept federal money, that is not connected to a hospital system, that is a freestanding independent practice. Those practices survive by getting paid out of pocket. So that's the first issue. Can they find them in a place that they have access to, that they can get to, that they have the means to get to that clinic, and then they have the means to pay for their care? Now, I think a lot of people are working very hard to find ways to waive those costs, etc. But some things aren't free. Puberty blockers, if they get the injection, aren't free. Sometimes these private practices, depending how much care they get, and have special deal from the pharmaceuticals on the cost of those medications. What about those that don't have access to that, that can't pay for it? They have as long as their puberty blockers will last in their bodies. And then their body will start to go through a puberty again. Again, this is cold turkey. This is not the way the body would do it and taper itself off. This is not the way we would treat any other patient on hormones that we were going to discontinue hormones. We taper them off. But that's not what's happening here. Then there's the group that's on puberty blockers that was in that waiting period, the reversible puberty blockers that just stopped puberty, didn't put them through puberty, just stopped it. They can be anywhere from ages 10 to 14, depending what age their body started some form of puberty, because you have to have started some form of puberty before you can be treated. So, what about them? They will continue to have a blocked puberty for as long as whatever puberty blocker they use is going to last. Or if they can get to one of these private practices, they can potentially get more there if they can pay for it. Now, some people have implants the insurance had been paying for, the same implants that are given to prostate cancer patients, the same implants that are given to precocious puberty. Those implants, the implants themselves, not the procedure to put them in, but the cost of the medication is over $100,000. So going to a pay out of pocket practice, this is not going to be an option anymore. Maybe somebody, but most people, it's not an option at all to pay $100,000 for an implant. So what about the injection? It's not going to be nothing. So it's going to be dependent upon whether they can pay the cost of the injection, go to a place that can give them care, pay for the injection to keep going. The final group of people are the kids that haven't hit puberty yet. They don't have any medical transition care. They're completely social transitioners. Some of them may have established care at a clinic, not because they're getting medical treatment, but just for support, for their health, for reassurance. Some have not established care, but knew that that care was out there and it was an option. Now those families are going to have to explain to their kids that things are changing. And if they can get them to one of those private practices and establish care, then they have the option and they can pay for the puberty blocker injections, etc. They have a chance. For all of these patients, that whenever they began their journey, were under the understanding and belief that transition care was an option for them. It was a treatment. They had a treatment plan. They had an understanding that there was an option for them for a greater quality of life. They had affirming care. Now it has to be explained to them why that is no longer an option. And carefully explain that the issue and the problem is not theirs. The hardest part I have when I listen to opponents of gender affirming care, it is very clear to me that those that have spent time with patients that are transgender, that understand and have really sat down and talked and listened and looked at the science and looked at the medicine and looked at the research, it's very clear who has and who hasn't. Has nothing to do with intelligence levels at all. It's the way they speak. Those that have humanity in their speech, those that don't. And as a medical system, and as a society, as a government, we have failed these patients. There is care for them. There is an appropriate evidence-based treatment. There is an option, an effective one, and we are making it difficult to get it. There's already been a disparity in healthcare and gender affirming care, and that disparity is going to grow larger. But more than anything, we're going to have to emotionally support these patients, these families, to keep letting them know that we see them, to affirm them, and that we're fighting for what we swore an oath to be able to provide the best care for all patients. May this be an ugly blip in our medical history, in our nation's history, because this is not doing right by patients. It's not doing right by humanity. To the youth out there that may or may not be able to receive gender affirming care at this time, that are worried, that are concerned, I see you. You are amazing just as you are. You are human. You are part of nature's beautiful biological diversity. Nothing's wrong with you. And everything we know supports that. Just knowing you supports that. So please do whatever you can to take care of yourself. And know that there's many people that are fighting to make this right for you. And we won't stop. Because we believe in science, because we believe in giving the best care to all patients, because we believe in you, and you matter.